Starting, all attendees are in listen-only mode.
Good afternoon. Today is May 14th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. Our presenters for today include Bernie Simons, the Deputy Secretary for DDA, and we also have Sherry Nolte, CEO from the Harford Center. We also have Nick Burton from DDA, and he is the CMRO Regional Director. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode, and there are two options to hear the webinar by computer and phone. If you look at the panel interface on your right labeled audio, you can click either computer or phone to switch for the best option. There is a handout for the webinar, and it is in the handout section in the panel to your right. They can also be emailed upon request. We are recording the webinar and posting that on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon. And I want to thank everybody for being here. As you can see, we've got on our agenda, and I want to thank her publicly for Sherry Nolte to be with us today and talk about her agency. You know, we've been doing this for a long time. Our next scheduled webinar was scheduled to be May 28th at 1 o'clock. However, that's the Friday of Memorial Day weekend. And so knowing that the governor has announced a lot of restrictions that have been lifted, and people may want to take a long weekend, we will not be meeting on that Friday, the 28th. So, and remember, we had talked about going to monthly meetings. So starting in June, we'll be meeting monthly until the end of the year. And obviously we will share those dates and links so that people can register. And in addition, again, I want to thank Sherry for being here from the Harford Center, who's graciously agreed to join us and share with us the successes that they did in staying open during the pandemic and what they're going to do moving forward. Next slide, please. So again, I think our highest priority is, as I said over and over again, is everybody's health and safety and well-being, not just for the people in support, but for their families, our staff, all of our providers, our regional staff, our headquarters staff, and that we're committed to staying very transparent with all of our stakeholders to ensure that we're all working together to support our shared mission of DDA. So again, thank you for being on these webinars. And you know, just because the governor did, and we'll get into it, still got to wash your hands. And you know, you might want to take a look at social distancing. I know that they can open up what we're going to talk about what the governor announced yesterday, but you know, you never can be too safe. And you know, we don't want to get reckless. We want to do this methodically, as the governor talked about in his orders releasing, in the CDC guidance, etc. Next slide, please. So as you know, the governor did lift the capacity restrictions for outdoor entertainment, art, sports venues, and indoor entertainment, sports venues, conventions, and all remaining restrictions on indoor and outdoor dining will go away on Saturday, May 15th. He also announced that the state's indoor mask mandate will be lifted as soon as we hit 70%. So again, we're not 70%. If you watched his press conference the other day, we're extremely close, but we're not quite there yet. We also talked about the vaccinations for adolescents. We know that there was approval from the FDA and the CDC, and that now Marylanders from the ages of 12 to 15, it opened yesterday, and 11 of the state mass vaccination sites and hundreds of pharmacies will be ready to administer the Pfizer. And remember that Pfizer is the one that is the approved by the FDA CDC for the 12 to 15-year-olds. And so obviously there is a link there that You can see where those areas are available at the covidmaryland.gov. Next slide, please. So again, the governor's order amended, and you can link on this to actually read the governor's order. Amended certain businesses and facilities requiring the use of face coverings. He said that announced this on May 12th with an effective date of 12:01 tomorrow or midnight tonight. And that all occupancy and operating restrictions are eliminated. Now recognize that the governor's done this in the past, but local jurisdictions have decided to stay more restrictive in where they are moving within their county. And so it doesn't necessarily mean that you shouldn't look at, what's going on in the county that you live in. The governor is allowing and has since day one, and has made that very clear that he is operating the state. He is doing these orders for the state, but the local jurisdiction still can do less than what he's doing. They can't do more because, again, it's a state issue with the orders that the governor's doing, but they can always stay more restrictive. We've seen that in the past where there were a couple of counties where the governor opened certain areas up, and a couple of counties decided they weren't going to engage with that. They were going to stay much more restrictive. And so again, it's a local order that they need to deal with. And then obviously effective immediately, the outdoor table size and distancing requirements for the state license alcohol beverage manufacturers are eliminated. So again, I'd ask you to go in and actually click on these links when you get a copy of this. And I believe all of this is already on our website. Next slide, please. So then Secretary Schrader has issued some orders also, and here are some links regarding certain businesses and facilities about restrictions. It's one thing to have the governor's order, and then the department secretary has the authority to also do, since it's related to health, safety, etc. So the other issue is there is a Maryland Department of Health advisory that talks about food, and a lot of this is reflective of the governor's order, but it's a little more specific. Next slide, please. So in the past year, we know that we've learned a lot. We've been through a lot together. People have been extremely resilient. And again, I think people that supported their families and, their person-centered planning teams, etc., have done an outstanding job. And now I want to mention, and we've done this in the past, when we early on talked about we were sheltering in place, basically. People were not going out, people were staying at home with families, and we had to learn a new way of doing business with using remote supports, etc. And so I thought it was important that we would bring up one of the earlier documents that we did that was done by the National Association of State Directors for Developmental Disabilities, or otherwise known as NASD, to take a look at as the governor's order announced that items would be more relaxed, and people would probably start thinking about planning about what does that look like in the future. We know that a lot of people don't want to go back to where they were. They're really satisfied with remote supports, etc. So we know that we're going to have something look much different than what we had in the past, but it's still planning. There's still going to be a physical contact with people. So we need to take a look at that, and what are some of the areas that we're looking at. And this is actually an update from the NASD than the last one that we had shared. Next slide, please. And so here's some additional resources for folks. to take a look at, and reopening strategies. We've also got in here again, the American Academy of Developmental Medicine and Dentistry that we had before. We've got our communication highlights, and we want to make sure that we, as the DDA state agency, have as much information out there as possible to assist individuals so that they can make decisions as people decide to reopen. What does that look like, and what is that pathway for getting back to a more normal life than we've been in since March of 2020. Next slide. So last week we had on our webinar Dr. Fetter, and we stated that we would be updating the checklist for our group of outbreaks. And what does that look like? And so there's a link there. And there's also CDC guidance from yesterday, 13th, that applies to non-healthcare settings. We had some questions about, are we a healthcare setting? I don't believe we would be. We're not licensed that way for our group homes or for our ALUs or for our rehabilitation programs. And we know that we're certified by DDA if we are not within a quote-unquote structure like a physical residence, etc. And so none of that in my mind would be that we would be considered healthcare. And we'll continue to coordinate with Dr. Fetter. As new information comes out, he's an excellent resource. We've got a lot of positive feedback about his presentations and everything he's talked about and instructed, etc. Let's go to the next slide, please. So we also obviously get a lot of questions about our programs, our services, initiatives, etc. And we want to keep this up to date, and we have been. We've just reflected this with a March 12th reference. You'll see on our FAQ page, and it's organized so that you can get to hopefully the information that you're looking for. If you can't and it's not there, you're going to contact the DDA, and we will be very responsive to make sure that any information that you need is there and available. Next slide. So we talked about supported employment. We had some questions come in. I signed a memo, and we sent that out. There were some questions about clarifications. We think we clarified it as well as we could. We had input from some of the providers about asking certain questions, and then again, we issued transmittals, about billings and all kinds of things about supported employment, even back as far as September 12th of 2014 on our service delivery and our scope, etc. So, as we evolve and, we all get better and we have different questions, people want to receive their supports differently, then we will evolve together and create whatever that new intervention looks like that people are very, very interested in order that they have a full life and happy and can fulfill what they've actually put into their person-centered plan. Next slide, please. So again, as I mentioned, this is the FAQs. We want to make sure we've got everything. You've got a lot of items on there as the Appendix K. We've been fortunate enough to have that to relax. Issues around billings, communication, provider application, self-direction, the EVV system, etc. So again, I'd ask you to go to the link that's on there that does DDA FAQs. And again, it was updated 2 days ago on the May 12th. Next slide. So CMS issued some guidance, hot off the press yesterday, and we have already had conversations with Medicaid, because Medicaid is the authority within the state over all Medicaid programs, including our 3 home and community-based waivers. And we will look at the guidance in the 9817 form of the America Rescue Plan. And again, we did have a conversation. Many of you know Rhonda Workman is our liaison to Medicaid, and she has already reached out, and we will be having conversations about what does this mean, what does the guidance look like, what does it cover during public health emergency, etc. And I know that there has been a lot of questions about the enhanced match that the state can be eligible for with that. So let's go to the next slide. Nick?
Thanks, Bernie. I just wanted to give folks an update on the Kennedy Krieger and John Hopkins drive-through vaccination clinic. They're having another one on May 23rd, and I got a text right before this started that those are filling up quickly. So certainly get in there, register. There will be a third one, which we will certainly communicate for. I went to the first one, and it is set up really nice. They've got a lot of support there. They've got a lot of volunteers. Even for those that may have sensory support needs, or those that just want to get additional information about the vaccine because they may be hesitant, there was tons of support being provided, tons of people that have experience with people with disabilities. So it's a really supportive environment, and it's actually pretty cool, the drive-through system that they have set up. So it's pretty great. Next slide. And then I just also wanted to say we continue to, as the DDA, work with providers, work with local health departments, working with our stakeholders and advocacy groups to make sure that we're getting clinics set up for people that are receiving our services, but also people that are on our waiting list. We're working on some efforts right now to support individuals that are self-directing their family members and employees to be able to get a vaccine, and there should be more information coming out on that pretty soon. And then we're also really wanting to make sure that we're hearing back from CCSs regarding folks on the wait list, but also if you know that there's some people who are hard to reach or that may need, maybe at home and unable to get out and need a vaccine, we really want to know so that we can reach those people. And then again, it's important for you as providers to make sure that you continue to fill out that vaccine survey that's going out, because we use that data to make decisions about where we need to focus our vaccine efforts within the DDA and with our community partners. And that is it for me.
All right, next slide. Well, I just want to say thank you again. You know, I can't thank everybody enough. I mean, our families, our providers, the provider staff, everybody who has really worked very, very hard to keep people safe and still provide services in many cases. And also the providers who have hosted multiple clinics. And, you know, we've had the opportunity, because you've done this, to have hundreds of people vaccinated who are, you know, in our services, their families, staff, etc. And so, you know, again, I think that it's a strong system that Maryland has in partnership with all of the members, families, providers, state, regional offices, etc. So people who self-direct, micro boards. I mean, everybody. I can't thank everybody enough. Let's talk about some of the numbers where we are as we give the update. And this is as of yesterday, May 13th. Central Region has 890 confirmed positives. Almost 1,300 are tested negative, and we've had 53 deaths. The East Region is 151 confirmed positives, 447 negative, and 6 deaths, and that's the same as the last time we reported. South Region is 630 positive, 240 negative, and 26 people have passed away. And in the West Region, 369 positive, 413 negative, and 17 people have passed away. And then when we look at our by region for our direct support professionals, the South Region is 421 positive, and 5 people have passed. West is 210 positive, and 2 people have passed. The East Region is 234 positive, and 1 person has passed. Central Region is 700 positive, and 2 people have passed. Next slide. So we've been doing this tracking, and this again is as of yesterday, 13th. And you can see again the pie chart on the left is about 89% of the 17,764 number, and with about 11% of the people, of those folks who have tested positive, and you can see the numbers on the right hand side with the line chart, with an increase in Central and then nothing in East and West, and only 1 in South. So, you know, we're seeing a lower and lower trends with seeing, you know, the numbers that we have, no increase. You know, I take a look at this data and I say 1 in the South and 0 and 0 in East and West, and 16 is, I mean, that's incredible in my mind compared to some of the numbers that earlier that we had. So again, I think everybody's being very diligent and doing an excellent job, you know, hand washing, social distancing, getting people vaccinated, etc. Next slide. So this is where we are with the chart on the left. This is from April 15th, as you see, until May 13th. We've had 0 participants pass away during that time period. And we've had 2,040 people who have tested positive. So again, I think that the pie chart on the right shows that the 102 participants who have passed away, or people in support who have passed away, is about 5% of all of the people who have tested positive. And I think that this is again a tribute to everybody's diligence, and shows a significant improvement as we continue to work through this pandemic. Next slide, please. So this shows about self-directed people and what the numbers look like. And, you know, we've got 37 who have tested positive and 0 deaths. And this is no change over our last 3 webinars. So, you know, again, I think that everybody's doing an excellent job who are self-directing these services also. Next slide. So obviously you can see this shows the number of people that we have who are participating from the agencies who have reported to us, and that there is about 69% who have been vaccinated and 31 who have not yet. Hopefully, as Dick talked about, those 2 upcoming clinics, and we know that other providers have been talking about doing additional clinics, that you know, it's really great. I mean, we've done 100. You guys have done 128 vaccination clinics. Just outstanding. And you know, we've got 8 currently scheduled. You know, from to between now and June 13th. So again, I think you guys have done excellent. We know that there's the drive-throughs with the mass vaccinations, and no appointments really required to take walk-ins, etc. Next slide, please. So this is where we are with the indicator of the families, administrative staff, direct support, and people who are self-directing. You notice with families, it's an increase of 40. In administrative staff, it's an increase of 102. It's an increase of 594 for direct support professionals from the last time we reported out. And it's an increase of 97 for people who are self-directed. So again, I encourage everybody to keep looking at this, to complete your weekly survey tracking for us so that we can share how we're doing. We've asked the coordinators of community services to start reporting on all the people who are on the waiting list, and also engaging with people who are self-directing. We do work through the self-directing advocacy network, but we know that all of the 1,200 people are not part of that association. So we work through our case management entities, our community and coordinated services. So, you know, again, I hope these webinars have been helpful. We've been doing this now since, March of last year. And, we've had, I think, a lot of success. We've had a lot of good participation, a lot of questions, a lot of suggestions that have been outstanding. And, that we want everybody to, if somebody has a notion about an idea and what that would look like, and so that we then at DDA can share on this webinar, so that, everybody can stay up to speed on what we're trying to accomplish in overcoming this pandemic. I'm going to turn this over now to Sherry Nolte, the Executive Director from the Harford Center, and she'll take it from here. And again, Sherry, I want to thank you for being with us today and doing this presentation.
Well, thank you, Bernie. Thank you for this opportunity. I want to also thank Nick for suggesting that I speak today. So I'm from the Harford Center. I'm the executive director there, and we are a day hab and supported employment program. And as you can see from my title, reopening, we never closed. And that's kind of my joke whenever I hear about day habs reopening. We never closed. We have not had a single down day. Next slide, please. So on March 17th, 2020, that was the big day when we got the notice from Governor Hogan that basically the world was shutting down, or at least it felt that way. We made a quick decision that we would redeploy our staff, our direct support professionals, into residential homes, but we didn't have a residential program. A lot of programs had day habs residential program. We are strictly a day hab and supported employment program. So I reached out to some of our partners in Harford County, and one by one went to them and said, what do you think of this idea? You guys are going to have to support people during the day. I've got staff I don't want to lay off. Would you consider my staff coming into your homes, providing day hab, and we would pay them between the two agencies, we would pay them what I'm asking for the residential providers to pick up the hourly rate, and the Harford Center would pick up the rest. So we'd pick up health insurance, unemployment, payroll taxes, that other percent of the wages. I had about 4 providers in Harford County say, yeah, we'll give it a whirl. I think our heads were all spinning at that time. So we had some great relationships, and we formed our Harford County Provider Coalition. And we decided we would meet twice weekly. We met Tuesday and Thursday mornings, and twice a week we would talk about all of our struggles, all of our outbreaks, all of our, all the new initiatives. We would share information. At that point, we were sharing staff. And it really became not just an information sharing, but a support group, a small support group for Harford County's providers. So we developed MOUs with these agencies, basically saying that we would hold all the liability, the workers' comp, all of the training, all of those pieces that an employer holds, and the residential agencies would welcome our staff into their homes to support not just their people, but our people as well. So we were supporting people we had never met in homes. We also built in an extra $5 per hour as an incentive pay because our staff were hired to do day hab work. They were not hired to do residential work, and we felt that we wanted, plus there was a risk working with people in their homes during a pandemic. So we reached out to each of our direct support professionals, and we basically pitched to them, and this is all happening on March 17th. So in about the course of 4 hours, we rallied, and we pitched to all of our direct support professionals the idea of going into residential homes, because it beat the alternative, and the alternative was we closed our doors at the Harford Center. About 90% of our staff said, yeah, we'll do it. We started virtual supports. We had a handful of staff who wanted to do virtual versus the residential homes. Some of the staff had childcare issues, had medical issues that would prohibit them from a higher risk of exposure. But the majority of our staff went to work in residential homes, and they were scared. And we were scared and tried to support them through this. At this time, we opted not to provide service in individuals' private homes. We consulted with our insurance company, and I'm a social worker. My background is in social work, and just my gut at this time was just saying we weren't ready to do this. The risk was too high given the pandemic, given not knowing whether families would have access to PPE and those sorts of situations. In June, we did reevaluate this, and we did offer the support into people's homes. Fortunately, and I say fortunately because it's kind of with a tongue in cheek, in the winter, so from like November to January, we had a huge flu outbreak. We thought it was a flu outbreak, more than we'd ever had in any other year. And we stocked up on PPE. We stocked up on hand sanitizers and wipes and masks and all the things that you would do if you have an infectious breakout. In hindsight, that was probably COVID. That's kind of what we're thinking with the symptoms, because a lot of the people that we thought had the flu were not testing positive for the flu, and then COVID hit. In addition, we moved our server, so for technology, because you figure we were working out of a center in the community, so we were all kind of centralized at one point, coming back to the building at some point, but we were spread out. All of our staff were spread out in residential providers all across Harford County, and we needed a way to keep in touch with them. So we moved all of our server services, all of our files onto a cloud-based system. And this is all literally happening in the course of a couple days. Next slide, please. We put in place some protocols. So again, the challenge was, in a normal situation, we had staff coming to a site, a base site, where they punched in, and then they, either got on buses, picked up people, came back to the building. But in most situations, we were out in the community. But we needed to take temperatures. We needed to make sure that our staff were healthy to provide supports to the individuals that they were providing the supports to. So what we did was, before a staff started shift, we had them take their temperature and send a picture of that temperature, that thermometer, with their face, so the supervisor could see that they were in different clothing and it was a different day with the temperature. And every day, supervisors had to manage all of these phone calls coming in, or all these text pictures coming in of people's temperatures. We also distributed masks on a weekly basis. We did the weekly care packages. In some cases, we had to deliver them to the homes. We immediately quarantined anyone who was exposed. We used the Family First Coronavirus Response Act money for payroll if someone was quarantined, which was an HR and finance challenge, to say the least. The HR department and the finance department were busier than ever. We did regular Zoom staff meetings to talk about concerns and fears. We also, just as an aside, we did upgrade our Zoom account so that we were HIPAA compliant, because we were also conducting PCPs and any other kind of confidential HR material over Zoom at this point. So we had to ensure that that platform was HIPAA compliant. We updated staff as much as possible during regular Zoom meetings. I know my executive team, we were meeting during those first couple weeks daily. We were meeting as a management team weekly, and we were meeting weekly with our staff just to process everything that was going on. We asked the DSPs what was working and what wasn't working. We weren't in the homes. It wasn't, and we didn't have the abilities to send our supervisors into the homes because it was a pandemic. So these were really unique times. The DSP suggested, probably in and around June, that folks needed to get into the community, that they were going stir crazy in their homes. And we had one bus a week go and be used so that we could transport people into the community to start some semblance of normalcy. Next slide, please. So this is kind of my methodology. We called it a wing and a prayer methodology. Basically, we took a leap of faith and we prayed that the decisions we were making were good ones. Obviously, we were basing it on the data. We were talking to other people. Anyone and everyone who would talk to me, I was talking to try to find out the best information. But this was, I kid with some of the people in my provider group, this was our first pandemic. We've never been through this. There was no playbook for this. So this is our wing and a prayer methodology. So we provided and billed for day hab services in the residential group homes. And the benefit was that we had the same staff that were working with individuals in the day habs were working with them in their homes. So there was some sense of continuity where there was a shift between what the days looked like and what the nights looked like. We provided virtual supports to people living with their families, and in some residential homes, we applied for every source of money that we could find. We applied for the PPP, the Paycheck Protection Plan, HHS, Health and Human Services Grant, A, B, C, D, E, F, G, I kid around, but everything you could possibly, from the CARES Act to local foundations to county money, anywhere and everywhere that we could find money, loans that turn to grants, foundation money, we applied for. We were able to apply for quite a bit of money in order to make up the gap between what we were providing in the homes and services and money to pay for keeping the lights on and paying for people's insurance. We also had a private foundation that paid for staff's insurance and a couple months of their incentive pay. So for those from March to June, we had a foundation paying for that. From there on, we had to use PPP money and HHS money and some other resources. Next slide, please. So fast forward to June. Based on our COVID numbers starting to improve, we reopened our building to family supports and offered supports in homes. So why is all this important? And I talked to my team. It's important that we look back to see what we've done well, how we got to where we are. And I don't want to be tedious in terms of going through all the details of it. But as you're starting to open up your day hab programs, I'm hoping you can learn from some of the things we did well and then some of the mistakes we made. So now we're opening the building. It's June and we're opening the building. The numbers in Maryland are going down. So the question is, how did we make this transition? So it's kind of a parallel. This is a year ago, but we're coming up on June of this year. PPP, we got face shields and masks and gowns and gloves, and we had it, but we really stocked up. We had our administration working from home. We still have our administration only coming in a couple days a week. And the reason is a couple of us got exposed while we were at work. And what we found is that in the quarantine period, we had to do things like sign checks and get payroll approved, the contract signed. So it really did benefit us to make sure that we didn't have key administrators working at the same time. So heaven forbid there was an exposure, at least one of our executive team was able to not be quarantined. We limited group sizes at this time. Normally our group sizes were anywhere from 4 to 6, depending on what someone's ratio is. We limited our group size to 3 participants to 1 staff, and we limited cross exposure. We didn't do it at first. We learned a hard lesson along the way, but in the end, we limited cross exposure. So 1 staff did everything from driving the person, picking them up, spending the day with them, and driving them home. So it was 1 staff, 3 people. So heaven forbid there was an exposure. We're talking 4 people and not multiple groups. We got a grant for PPE to outfit 12 passenger vehicles with plexiglass. So we put plexiglass in between seats so that if someone and some of our individuals can't wear masks because of their disabling condition, we were able to support them safely. And we limited the vehicles to 4 people per vehicle, including the driver. Now we're up to 6 people per vehicle because we have 12 passenger vehicles and we have plexiglass. Next slide, please. So from June to January, we slowly increased the numbers in the building and we limited community outings. We were in the community though, where people were able to wear masks. We were in the Targets and in the Walmarts. And when people were not wearing masks, we were outside and it was cold and people bundled up and we made the best of it. Staff wore masks all the time. That was never relaxed, and we provided the masks that staff wore. We did have COVID exposures. And this isn't but we had less COVID exposures than residential group homes. And this isn't to say that we were doing it better. We were doing it differently. So whereas in residential, you have multiple staff coming in because you've got to cover a 24-hour shift, and you can't have one staff covering 24 hours. So where we had one staff with 3 people, you may have a home of 3 people, and over the course of 24 hours, you might see 6 staff, which increases exposure. So the exposure that people were having being with us is actually less than in residential. Same protocols being followed likely, but less exposure. So being back in the community and being in the day Habs certainly didn't increase anyone's exposure. And I think that that's something that needs to be put out there. When we did have exposures, we reported to the health department and followed all guidelines to the letter. We also communicated to the residential providers. We had a very open line of communication, and it was a no blame kind of relationship. It's, this staff person who was in contact with your staff person has COVID or was exposed to COVID. We tried to be very forthright for the sake of the staff and for the individuals. Next slide, please. So the vaccine, we just talked, Bernie just talked a lot about getting the vaccine, getting, vaccines into arms. We had our board of directors and myself and our executive team, we came up with kind of some pillars, some philosophy, some values. And our values really were about access. We committed as the Harford Center to get the vaccine to people, whatever it took. So we became huge. We wanted to open up the center. How could we make the vaccine accessible? Unfortunately, in hindsight's 2020, the state, the nation pushed vaccines into residential homes, into group homes, into nursing homes, et cetera. However, folks who were needing the day hab services were not able to get the vaccine. There weren't ways for us to connect with the pharmacies. So I reached out to some of our contacts on a national level, some of the leadership groups I'm a part of. Nick knows I got to him. In addition to Harford County, I got to the director of the health department in Harford County, and anyone who would listen to me kind of on my soapbox about getting the vaccine out to as many people in day hab as possible, not just the ones who lived in residence. We also educated our staff, we educated our families, we educated our participants. I had someone who was a part of the Moderna original study, who is a former colleague of mine. He was part of the original test group in August who got one of the vaccines. And he came and spoke to my staff about what it was like being one of the first, basically in the nation, to get the vaccine in his experience. And he was so humble and he's a doctor, so he had certainly some background in order to speak to this topic. And I think that was really what helped our staff make the decision. And we also incentivized it. We gave a gift card to staff who got it. Next slide, please. In February, all our 1A staff got their vaccines who wanted it. We didn't mandate it for staff, but we did ask them to tell their stories, to get it out to other staff who may be uncertain. Anyone who's willing to tell their story. It wasn't mandated, but we really encourage people to tell their story. On March 17th, 2021, a year later, happy anniversary COVID, the Harford County Health Department provided its first vaccine clinic for our individuals. Thank you to Dr. Bashai, who I know isn't on here today, but has really been a voice for Harford County, and I just want to give him a shout out. I also have to give a huge shout out to Nick, who heard me rant and vent on more than one occasion and took a leap of faith with us in allowing us to have a mass clinic at the Harford Center over the course of 2 days for all of Harford County, not just for our participants and our family and our staff, but any agency that wanted to come, any family members of people who had disabilities who wanted to come, in addition to some essential government employees. So we were able to provide an amazing service to our community, because the safer our community is, the quicker we'll get back into it. Next slide, please. So for you data lovers out there, so we had almost 75% of our staff have been fully vaccinated, which is higher, and I've done kind of some surveying of my own, is higher than a lot of agencies have experienced. And I think part of that is really that we approach this with a lot of heart. We got the information out. Staff who wanted to talk one-on-one, we didn't push it, but we really encouraged and we made it accessible for people. 16% declined, and about 9% are either waiting for the vaccine because they couldn't get it because they've had COVID or waiting for it for whatever reason medically, and some are still thinking about it. For our individuals, we have 72% are fully vaccinated, which is a lot lower than residential, and I'll tell you why in a minute. 9% declined, which is not the unusual statistic. The unusual statistic is that we have 19% of the people we supported previous to the pandemic that have been non-responsive. They're not answering our emails, they're not answering our phone calls, they're not answering service coordination. This is the most concerning group of all. So we have a good amount of people that have completely fallen off the services, and that's concerning. So that really is where we're focusing our effort on how to get to those folks, and we're working in close conjunction with service coordination. Next slide, please. So our lessons learned, and these are the things that I hope you take, Harford Center, we're humbling ourselves to say we've made some mistakes here. And if we can prevent another agency from making our mistakes, please, take note of these. So go slowly and keep one staff with one group for all support services. We did not do that early on. Instead of having one staff expose 3 people, we had one individual expose 12 people because this individual wandered through the building and multiple staff supported her. And yeah, we learned some lessons, and we were able to kind of tighten things up a little bit. PPP for everybody, make it accessible to your staff. Limit who is in the office in case of exposures. As much as I want to be back and have, and be present, it's also really important that you realize what your role is in terms of keeping the agency going, and you have to limit that exposure in terms of making sure that bills get paid, et cetera. Don't be afraid to remind staff how to wear PPE, and I'm not talking about trainings. I appreciate the trainings that Dr. Fetter has given. However, it's more important that supervisors and administrators remind staff if their masks are below their noses, walk up to them and say, pull your mask up. It doesn't have to be a big deal, but I see it's uncomfortable for people to say that. Just say it. It gets less uncomfortable the more you say it. We also celebrated all our victories. Every single victory that we had in terms of, when our numbers increased, when any little thing we could find to celebrate, we celebrated. But we also recognized the losses. We did lose one individual to COVID, and we did a virtual memorial service, and it was awful and hard. And staff and we did a picture kind of memory of this person. You have to do that stuff. Track everything in case there is an exposure. If you don't have a contact tracer and you are thinking of reopening as a day hab, you need to have one. Get with your local health department, they'll help with the training. Talk about the fear, be honest about it. People are afraid, they're still afraid. Be honest, talk about it. Be transparent and say, I don't know. I said I don't know more this year than I've said, I think, in my entire life. There were so many things that we just didn't know. And I said it. And a lot of times I would have to say, I don't know, and let me figure it out and I'll get back to you. Or I don't know, but let's give this a whirl and see what happens. Create physical PPE barriers. So if people are eating lunch together, make sure that they are spread out. It seems like common sense, but social norms tend to dictate, and people tend to go back to what they're used to. So you really, as supervisors, really help your supervisors be in that role of making sure people are staying distanced. Even with things being relaxed from the governor's office and the nation, we really need to be continuing, as Bernie said, to be vigilant. Apply aggressively for grants. I can't underscore this enough. If you don't have someone to write grants for you, find somebody, because it's that important. Next slide, please. Revenue, that's what most of the execs out there want to know, is how do we stay afloat? So from March to June, we were at 30% attendance, so 30% of our revenue, that was it. The gap was grants, PPP, HHS, ABCDEFG. That was how we made it happen. From June to November, we were between 30 and 40%, so still pretty low. Basically, we budgeted based on benchmarks. We met early on weekly. My finance director probably did, and this is not an exaggeration, Tim, you know that, is like 900 iterations. So we were basically on a daily basis looking at where we could cut expenses. We cut expenses on our vehicles. We were only using 6 vehicles, so we stopped the insurance on the others. Reached out to Dimensional and said, we don't have people here. How do How do we slim down our contract? And Dimensional not only did that, but they also gave us a little bit of money to help us with PPE. So it's amazing when you ask what people will do for you. Virtual services, or a large part of attendance, we will be continuing that. We have some individuals who have really enjoyed that and have really learned technology as a result. So there are some things, some real positives that we have learned from this experience. Our present attendance is about 50%, so it's coming up. Our target for July is 70. That might be a bit aggressive because I met with our finance and program today, and they were shaking their heads at me, but we'll see. If we can get there safely, we'll get there. And if we can't, we'll figure it out. And that tends to be our new mantras. We'll figure it out. Next slide, please. So this is just some for you data lovers out there. This is our data trend from June 1st till the end of April. If you see the dotted blue line, that is our trend line, which you can see our census is slowly coming up. And I can't underscore that enough. This is not a race. It's not about growing revenue. It's about being safe. That's what's important. And you see some dips. Some of the dips are when we had 4-day weeks, like for Christmas or 4th of July or some of those. The big white line is the exposure. That was when we had the 12 people exposed because we felt that that was a significant enough event that we wanted to mark it. Next slide, please. So what you'll see here is this, in this jumbled slide, the blue lines are the national numbers for COVID. As the national numbers for COVID cases goes up, our census went down. There was a directly inverse relationship between the nation's numbers of COVID cases and what our census was. I just thought this was really interesting, and I bring this up to say you have to watch the numbers. Look at what the positivity rate is in Maryland. It will help guide you as to how quickly or how slowly to reopen your day hab programs. Next slide, please. So why is it critical for day habs and support employment programs to reopen? It's a quality of life issue. This population has the same rights as the rest of us. We have been given the choice to return to work, play in our communities, and our individuals do as well. They have the same rights. They've been in their homes for a year. As much as we all are afraid and we want to protect them, we need to help them start readjusting to reintegrating. With precautions, reopening is safe. Over the past year, we've had less exposures and than residentials have had. And again, this isn't we've done it better. We've done it differently. Adjustment back to day service is just that, an adjustment. We have team meetings for every single individual who's coming back, and we look at what that looks like. For some people, it's coming back 1 or 2 days a week. For others, better just to rip the Band-Aid off and get them back, because knowing that individual transitions are not their strength, and we had to really just be assertive in terms of how we made that plan. Develop policies for community and indoor groups. Develop policies for exposure notification. Just develop policies. If you need some policies or suggestions, reach out to me. We're happy to share those. We want to be helpful. We want to have a partnership because it benefits the community. It benefits Maryland. Consult with your local health department. Educate your staff, set expectations, and model these expectations. I know I'm running out of time. So next slide, please. Last one. So just a huge thank you to the DSPs. They're who made this happen. I'm the one speaking, but they're the one who made it happen. They were doing the hard work. They were doing scary things, and they were doing it well. And I commend not just my staff, but all the DSPs out there in Maryland. A shout out to Tim, my finance department, who had to be creative, deal with me and multiple grants and FFCRA, and to Dave for program, who had to realign everything he did. He was not running a day hab. He was basically running a liaison program between residential and our Harford Center. Facilities had to be cleaned, and buses had to be cleaned, and PPE had to be stocked. And I just want to thank my Harford County Provider Coalition for that robust effort that we had in pulling together Mid-Atlantic, Service Coordination, the ARC, Ridgecroft, Abilities Network, Unified, Gallery of Catholic Charities. I could not have done it without all of you, and I just want to say thank you so much to the Harford County Provider Coalition. And I thank you all for your time. Anyone has any questions, please reach out to me. Any member of our team, we are happy to share our experiences with you. Thank you, Bernie, and thank you so much, Donna, for having me today.
Sherry, thank you so much. That was just phenomenal, full of energy. You have just done everything. It sounds like you have a great team, resources from your community. We're very proud of the work that you're doing, and please continue to do that. I just wanted to share with the group that the upcoming, as you heard, Deputy Secretary, we are not meeting the last week of May. We are going to start in June. Please note that these are the rest of the year meetings. We're meeting now once a month. It's really the last Friday of every month, with the exceptions of November and December because they fall on a holiday. This is the new link. So if you want to continue to attend our webinars, please re-register. Here's the link. It will give you it'll go right directly into the form, and then after you register, you'll receive confirmation of the email containing all of the webinars moving forward. So thank you all. I am going to next slide, see if there's any questions, and if there's not any questions in our chat box, I will turn it over to Bernie. I think that right now we don't have any specific questions in our chat box. I'm going to wait a few seconds, and I don't see any. Robert or Rhonda, you see any that we need that have not been answered? Okay, I'm going to turn this over to Bernie.
Well, I want to thank Sherry for being here today and doing that magnificent presentation. You know, I think we probably need to think about maybe as we go forward with the future with our monthly to talk about where the status is and continue to engage and have our providers from around the state. Maybe we feature one every month. You know, I'm just thinking out loud now, but I think it's you know, we've had a few providers do presentations. They've all been outstanding. Today was great. The ones we've done in the past have been great also. So with that, I want to thank everybody. I want to thank everybody for their support. And again, you know, we know we've been all in this together. We said from day one we'll get through this. You know, we're seeing, I think, a lot of people being vaccinated, the numbers going down, the governor's orders, you know, basically relaxing. For those of you who haven't seen it, I just got an email a little while ago saying, I believe the governor's doing a press conference at 5 o'clock again today. I assume it's on the COVID. And since that's, you know, obviously the last press conference had more than just COVID questions that came from the reporters. But again, I want to thank everybody for being here today. And this was, again, thank everybody for their support, your diligence, everything you do for everybody that we provide services to and supports to through DDA. Have a blessed weekend.